Torn ACL Rehabilitation by Jake Matthew. The ACL stands for the anterior cruciate ligament. A ligament is a fibrous connective tissue that attaches a bone to another bone. They work to keep the structures together and to stabilize them. The ACL is located in the knee joint, and it connects the femur, which is located in the thigh, and the tibia, which is one of the two bones of the shin region. The ACL works to prevent the tibia from sliding out in front of the femur. As seen in the picture, there are other ligaments here working with the ACL to provide additional stability and support. The ACL has the term anterior because it is the closest to the front of the body. Behind the ACL lays the posterior cruciate ligament, which is also called the PCL, and this also works to stabilize the knee joint. The ACL is very important for proper knee function. However, unfortunately, an ACL tear is one of the most common and devastating sports injuries. ACL tears usually occur during physical activity such as a sport. As soon as they happen, a loud popping sound is likely to be heard, and there will be immediate pain and swelling in the knee joint. Many athletes have undergone ACL tears during their careers, and they are known to be one of the hardest injuries to fully recover from. Some famous athletes who have torn the ACL include Odell Beckham Jr., Saquon Barkley, Derrick Rose, and Klay Thompson. The ACL is usually torn because of a sudden change in direction or quick movement when the foot is planted. Most of the time, it is a non-contact injury. However, if the knee joint is hit from a certain angle, an ACL tear can occur. An awkward landing or motion of the knee joint is what caused most of these injuries for the athletes that I mentioned. Regarding the injury itself, there is a difference between partial and complete ACL tears. As shown in the picture, the ACL is completely torn into two separate parts. However, it could only be torn on one side and not fully through. A partial tear is less likely to occur, but it is possible and it may require less treatment. The ACL is the most commonly injured knee ligament. In fact, in the United States, there are about 100,000 and 200,000 ruptures per year. In the graphs, the numbers show the amount of ACL injuries based on sport, age, gender, and by year for a younger age group. This shows that this injury can occur at any age and will still have negative effects for the future. In graph 1, a study was conducted and the results show that girls soccer produces the most ACL injuries, followed by boys football, girls basketball, and girls gymnastics. These sports all include a lot of quick movements and motions that could result in ACL injuries. In the second graph, the amount of ACL tears differs between ages and gender. Females seem to have more ACL injuries until the age of 17, where the males have a higher rate of ACL injuries. In the third and final graph, it shows the rates of surgically reconstructed ACLs per year in the study. As you can see, these percentages are high as many people prefer to have their ACLs surgically fixed for a faster recovery. I will get into the surgery and recovery process in the following slides. After an ACL tear, most of the time athletes and people who want faster recovery times choose to get a surgery done to reconstruct the ACL ligament. The ligament does not have enough blood supply to fully heal itself, and that is why surgery is usually recommended. The surgery is usually done with a graft, a piece of living tissue that is transplanted. Most people choose to have their surgery done as early as possible to prevent any other injuries to the meniscus or cartilage. These two are other parts of the knee joint that help with stability and shock absorption. People who suffer an ACL tear should still try to complete physical therapy and try to regain range of motion as much as possible prior to the surgery. After surgery is complete, one should be able to walk out of the hospital on the same day. From that day on, physical therapy starts again slowly, and it can take about 9 months to fully recover from an ACL tear. Physical therapy and the recovery process is a long process, and in order to fully recover, one should follow their therapy plan very strictly. This is especially important for athletes who want a fast, effective recovery so that they can continue to play their sport. There are many different exercises one can do to strengthen the knee joint and to feel safe using the ACL ligament to its full capacity. These slides will go through a 30-minute workout consisting of 8 low-intensity exercises to complete within the first 2 to 4 weeks after an ACL reconstruction surgery. These exercises will help strengthen the leg muscles and keep the knee joint stable. As the knee gets stronger and more stable, one can move to workouts of more difficulty. To start the workout, one should walk a mile on either a treadmill or outside. Walking is very important as a warm-up to prepare the leg muscles for the workout. To start, one should complete a long sitting towel calf stretch. You sit down on the ground with both legs outstretched on the floor. Then wrap a towel around your foot of the injured leg as seen in the first picture. Then pull the ends of the towel with both hands in order for your toes to be pointed upwards. One should hold this pulling position for about 30 seconds. Complete 2 sets of 30 seconds of this exercise. Next, move into the supine position, laying down with your back on the ground for the second exercise. This is for the supine straight leg exercise. From the ground, raise the injured leg up as much as you can without bending the knee joint, as seen in the picture. At the maximum height, hold the leg in the air for about 15 seconds and then relax it. Complete 4 sets of 15 seconds for this exercise. The third exercise is the seated heel slide. For this, one should sit down and have both legs extended once again. This time, keep a towel underneath the heel of the foot of the injured leg. This needs to be done on a smooth, somewhat slippery surface so that there aren't any bumps. Then, from the fully extended position, slowly bend the knee joint so that the heel slides towards the body. After bringing the heel in, slowly straighten the leg back out to the fully extended position. 1 rep is a full back and forth motion. Complete 2 sets of 15 reps for this exercise. The fourth exercise is called the quad set. Start in the supine position and place a rolled up towel right below the injured knee joint. Then try to push the back of the knee joint down on the towel using your quadricep muscles of the thigh. Flex the muscles and hold for about 10 seconds. After 10 seconds, 1 rep is complete. Complete 2 sets of 15 reps for this exercise. The fifth exercise to complete is called the ankle pump. Start in the supine position and keep the injured leg extended on the ground. From here, using your quadriceps, lift the ankle off the ground and point the toes upwards. Hold this for 5 seconds and then point the toes down and relax. 1 up and down motion counts as 1 rep. Complete 2 sets of 15 reps for this exercise. The sixth exercise is the prone hip extension. Flip over to the prone position with your belly on the ground. Now, without bending the knee at all, lift the injured leg up and hold for 10 seconds. After 10 seconds, you can now relax. 1 up and down counts as 1 rep. Complete 3 sets of 10 reps for this exercise. Next, the seventh exercise is the prone knee flexion. Still in the prone position, this actually focuses on the bending of the knee. Using the injured knee, slowly flex the knee joint so that your foot gets closer to your back. Go as far back as you can and hold for about 5 seconds. After 5 seconds, one can relax. 1 up and down motion counts as 1 rep as well for this exercise. Complete 3 sets of 10 reps for this exercise. Lastly, the eighth exercise is the mini squat. One needs to stand up for this exercise and use a chair or a surface to hold on to. Once you find a good spot, stand up straight holding the chair and line up your knees with your feet and shoulders. Still holding the chair, one slowly bends down with both knees. It is called a mini squat because it is not a full squat and you are not fully flexing the knee joint. Instead, it just helps to strengthen the muscles around it. Complete 2 sets of 15 mini squats for this exercise. These 8 exercises conclude the 30-minute workout. One should take breaks between each separate exercise as needed, but try to only rest for a few seconds between each set in a certain exercise. This workout should be done consistently throughout each day of the first 2 to 4 weeks of recovery. However, it must be done with low intensity and at a very balanced pace. The workout is not meant to be rushed or overdone because that could lead to further injury of the knee joint. The more time spent strengthening the knee muscles, the healthier and faster the knee will recover, but it must be done the right way and at the right pace. The short-term goals of the ACL recovery process is to strengthen the surrounding muscles, decrease the chance of re-injury, and create more functional stability in the knee. The long-term goal is to fully recover and have the same function level as the opposite knee that was not injured. Overall, ACL tears are very devastating injuries, but with hard work and perseverance throughout multiple months of rehab, one can fully recover. Thank you.